Weight loss medication.
I think the FDA knew, I think the providers knew that this is going to be successful.
It's grabbing waistlines and headlines, but new data is trending in the wrong direction.
Then people are seeking it from like compounding pharmacies or buying it over the internet. That's probably the number one reason why these accidents are occurring.
And with an already big appetite for demand,
for the last 17 years, this is the first one we've got so much request for.
There are even more weight loss drugs in the works.
I think this has just opened the door. Is it good or bad? I'll just leave that up to you.
Ozempic, the commercial with a catchy song that's capturing the world. It's a drug made by Novo Nordisk, and it was approved by the FDA back in 2017 for people with diabetes. And we don't want to get the diabetes medication confused with what we're talking about, semaglutide. It's an active ingredient in Ozempic and a second drug made by Novo Nordisk called Wegovy. In 2021, the FDA approved Wegovy, a medication specifically for chronic weight loss management in adults, and the first drug of its kind since 2014. Novo Nordisk, the maker of Wegovy, say at least 25,000 new patients start on Wegovy weekly, and that number is growing.
Semaglutide mimics a type of hormone our gut produces when we eat a meal. It sends signals to different organs when we eat, like our brain. It tells us when we are full and suppresses appetites. It's also known to slow down gastric emptying so you feel fuller longer. Wegovy uses a pen like this. Patients get a pre-filled dose to inject weekly. Without insurance, Wegovy costs about $1,350 for a month's supply, totaling to more than $16,000 a year. And while some pay with their insurance, many are struggling just to get their prescriptions filled.
Heightened demand created a semaglutide shortage. Those who can't get their hands on the name brand or afford it have been turning to an alternative: compounded semaglutide. Patients are given a vial and a needle to administer the drug themselves, which has led to accidental errors. That's now caught the attention of poison control.
I can say the majority of these accidental exposures are from using a product like that that's compounded.
Justin Lewis, a pharmacist and director of the California Poison Control System, Sacramento-Division, says since 2018, poison control has seen an increase in semaglutide exposure calls.
Then people are seeking it from like compounding pharmacies or buying it over the internet. And when you get it that way, it's often in a multi-dose vial that the patient has to draw up and inject in themselves. You can get the compounded prescription for a fraction of the cost of what the brand name products go for.
In 2018, the California Poison Control System received approximately 30 calls. By 2021, that number increased to over 100, and in 2023, calls jumped to over 350. Poison Control is forecasting an increase in calls.
Poison control. The majority of the calls are just really severe gastrointestinal, nausea, abdominal pain, vomiting, and then sometimes to the point where they just can't keep anything down, get too dehydrated, have to go to the hospital. Some patients don't want to wait that long, and so they just start on the higher dose and then immediately have much more serious gastrointestinal symptoms. How long ago did this happen now?
When Lewis and his team answer your call, they're determining the best treatment.
They can't keep themselves hydrated at home. More severe symptoms, like if there's vomiting up blood or if they're feeling confused. We are seeing some cases of low blood sugar, which is really dangerous. If your blood sugar gets too low, you can pass out or have seizures.
Among concerns about compounding this weight loss medication, counterfeit semaglutide.
Counterfeit semaglutide has flooded the market. Novo Nordisk, the manufacturer of Wegovy, has filed 21 legal actions against medical spas, weight loss clinics, pharmacies, and other companies that have engaged in deceptive, unfair, unlawful, and dangerous practices regarding the marketing and sales of alleged semaglutide products. After testing, the company found that some of the compounded drugs had no semaglutide. Another lawsuit alleges an online retailer was selling semaglutide to patients without any prescription from a medical professional. The key is to know what and from who you are buying a product from. Because semaglutide has been on the FDA shortage list, compounding pharmacies are allowed to compound semaglutide, and they've been very busy.
Honestly, I think for the last 17 years, this is the first one we've got so much request for. It's a very unique situation. It's not something you see all the time. We get like 10 to 15 calls a day.
Dr. Masood Rashidi is the owner of Innovative Compounding Pharmacy in Folsom, an accredited sterile compounding pharmacy that's been around since 2007. They are one of 2 sterile compounding pharmacies in the area that can compound and fill prescriptions for semaglutide.
You know, we do a lot of testing. I know there are bad apples out there, so make sure you call your pharmacy or whoever you're getting it or the doctor. Just make sure they're doing their job.
Dr. Rashidi walked us through how his pharmacy tests semaglutide before they can buy a product or fill a prescription.
We send it for potency testing and sterility to make sure what you're giving patients is what that label tells you it is.
While compounding drugs are not FDA approved, Dr. Rashidi says his compounding pharmacy only works with licensed sellers.
We buy from the wholesalers that are approved by FDA and the state board. It's an open thing. We're not hiding. We're proud of what we're doing. And if the patient wants it, we can show it to them, say what we've done.
And he says you still need a prescription to get semaglutide.
Stay away from the online stuff that you're not really knowing where is it coming from. If it doesn't have a pharmacy name or doctor's name, I mean, you can't get this stuff without a doctor's prescription. If it's coming, it's a red flag already. It's just not about price sometimes. It's your life and your safety.
We spoke to the FDA. They say that they have received more than 30,000 adverse event reports for semaglutide through May of 2024. Reported side effects ranging from vomiting, nausea, to gastrointestinal disorders. More than 240 adverse event reports involved compounded semaglutide. The FDA's adverse event reports are self-reported and reported by healthcare providers. The reports are not medically verified by the FDA.
The goal should be looking healthier, not lighter.
Dr. Ansari, an endocrinologist with 17 years of experience, says taking semaglutide is not that simple.
There's no such thing as magic drug. You have to have a comprehensive knowledge on what it takes to lose weight and maintain weight.
Weight loss, even with semaglutide, requires a lifestyle change, from the foods you eat to increased physical activity.
The key for this medication is to really start low dose and have patient acclimate to it.
Semaglutide has a long half-life. Dr. Ansari says it can take anywhere from 2 to 3 weeks before the medication is out of your system.
If you are manifesting any side effect, usually can take up to a week before people start feeling better. You have to really warn them that in case if they start having any kind of sudden onset abdominal pain, there's always a concern on pancreatitis, which is a very life-threatening disease or a condition.
Which is why Dr. Ansari suggests patients should connect with a licensed healthcare provider who has knowledge of how the medication works and can track progress and more. Telehealth appointments are connecting patients with doctors that don't always know a patient's history. Some patients we spoke to for this story told us after having one telehealth appointment with a new doctor, they were prescribed semaglutide almost instantly. Healthcare providers say that's a red flag.
I think that patients should be smart enough to really recognize those red flags, and before they make any of these decisions that may jeopardize their health, they should think twice, before they're really putting this medication in their system.
Working with a healthcare provider you trust, getting a basic lab workup, and monitoring any new onset symptoms are the green flags patients should look for.
My take-home message is to really talk to your provider. They understand your health conditions.
Have you ever seen a drug become this popular that people want to get their hands on it?
No.
But Dr. Ansari says there are more weight loss drugs in the works, such as Triple G, which has an effect on glucagon.
Glucagon is like an anti-insulin hormone. If it's going to pass the FDA approval, it would be a game changer. Is it good or bad? I'll just leave that up to you.
And currently there are no FDA-approved generic versions of semaglutide. And if you do choose to take this medication, I want to reiterate, do your homework. Know where your product is coming from. Start low and go slow. Have real expectations and talk with a licensed medical professional.